Picture the drive to the airport. You have just crossed 3 state lines to sit in front of the only doctor who would still see you. Not for a vacation, not for a second opinion. You made that drive because in your own state, every door was closed to you. Every single one. You are a pain refugee, and right now, you are almost home. You did everything right. You followed the rules. You found the one doctor with the courage to help you, and then the lights come on. And everything you have left is about to be taken from you. When a state pulls a pain doctor's license, it does not just end one career. It abandons every patient that doctor was keeping alive, all at once, with no warning and no plan. In one Montana case, advocates count roughly 180 people, most of them medically complex, cut loose almost overnight. The state manufactured that emergency, and then the state walked away from the wreckage it made and called it justice. We call these people pain refugees. And every time a doctor is driven out, becomes ill, dies, or loses a license, a new wave of them is set loose to fend for themselves. Some ration what little they have left, then land in an emergency room just trying to reach next week. Some are turned away by doctors who would help if only they were not so afraid of being next. Some are driven to the street where a single counterfeit pill can carry enough fentanyl to stop a heart. And some advocates say cannot survive the despair. The research does not flinch from this. When pain care is torn away, the risk of suicide rises. These are not statistics. These are our neighbors, and this is the cost of a signature on a suspension order. But some are lucky. They find the oasis. They find a doctor with the courage to look at the hardest cases and say, "I will help you." For years in Montana and far beyond it, that oasis was Dr. Mark Ibsen. Complex pain patients often need higher doses than the average person. Not because anyone is careless, but because a body that has lived in severe pain responds differently. Those doses can make a pharmacist nervous. For these patients, they are also exactly right. Dr. Ibsen knew the risk in treating these patients. He knew it would put a target on his back. He treated them anyway. That is who he is. And his supporters argue that this is exactly what draws the attention of regulators. That agencies under pressure to show results reach for the easiest target. A solo physician has no legal department. A solo physician does not shoot back. We have seen this pattern before in this series. A dramatic, camera-ready raid. Boxes paraded out for the evening news. A caring doctor recast as a kingpin for an audience that has never lived a day in chronic pain but has seen plenty of cartel movies. It is far harder to catch a real trafficker than it is to stage a raid on a doctor who answers his own front door. In 2022, the Supreme Court ruled in Ruin versus United States that the government must prove a doctor knowingly prescribed outside the bounds of medicine. Good faith is a defense. Advocates say that is the standard these cases keep failing to meet, which brings us back to that highway. A pain refugee driving to the airport after an appointment he could not get in his own state was pulled over. His medication was seized. He was accused of drug trafficking, and he sat in a jail cell for months while his pain went completely untreated. Then a judge looked at the actual evidence and threw the case out. The accusation did not survive first contact with a courtroom, but the months in that cell, those he does not get back. And shortly after that patient was arrested, Dr. Ibsen received notice of new proceedings. Dr. Ibsen and his supporters believe the patient was never the real target. They believe he was the pretext. That after years of failing, the state finally found a door. That after years of failing to make anything stick, the state finally found a door to knock on. I am not telling you this from a safe distance. I was one of these doctors. I know what it is to be treated like a criminal for caring for the patients no one else would help. I survived it. That is a story for another day, but it is exactly why I will not stay silent about what is being done to Dr. Ibsen or about the patients who pay the price. This is not a story about one man in Montana. It has happened to hundreds of good doctors, and the next patient stranded on the side of that highway could be you. So we are not going to ask for your sympathy. Sympathy changes nothing. We are asking for 60 seconds and a few clicks. 1. Email your elected officials. These are their own constituents being crushed. Make them answer for it and demand a fair and transparent process. 2. Email your local newsrooms. The cameras showed up for the raids. Ask them where the cameras are now and demand they ask the hard questions. 3. If all you have is a single dollar, send it to Dr. Ibsen's legal defense. He is standing against the power of the state, and that fight will cost more than he has. We built one page that does all three. You register once. You send your messages in seconds. You give if you can. It is already waiting for you. Nothing frightens an unjust process like the eyes of the public fixed on it. So stop being a bystander. Silence lets this happen again and again. Maybe we save Dr. Ibsen. Maybe we save the next doctor they come for. Maybe we keep you off that highway, but only if you move. You are not helpless. You are not powerless. Let's use that power and tell them in no uncertain terms. Take your hands off of Dr. Mark Ibsen. Go now. Click. And while you are there, download a code to enjoy my website's cheat codes and biohacks like weight loss shortcuts, quick science courses, supplements, DIY skincare solutions, and more for free. Go to unbedsidemanners.com and stand with Dr. Ibsen. Do it right now. Click.